I'm Dr. Timothy Miller. I'm a gastroenterologist at Lubbock Digestive Disease Associates and Covenant Health. So we've here at Covenant put on a free what we call colonoscopy clinic or colon cancer screening day. Basically, this is a time to reach out to our underserved or underinsured population to get them their colon cancer screenings. Colon cancer is a very common type of cancer. It's the third most leading common type of cancer and the second most common cancer killer. And so if people get colon cancer in a late stage, they often do, unfortunately, very poorly with it. It is a deadly cancer. The best thing about colon cancer is most of the time completely preventable. And so if we can catch polyps early, catch cancers early, then we can cure them most of the time. Actually, we can even prevent the cancer from forming in the first place by removing the polyps. Colon polyp is a growth in the colon wall. Again, the colon's a large intestine that lasts about 4 feet of our intestinal tract. Polyps will develop without any signs or symptoms or warning or risk factors. People just get polyps. And so that's the goal of a screening colonoscopy. Identify a polyp if you have any. Not everyone will have polyps. If you have one, remove it while we're in there and prevent a cancer from growing. Colonoscopies are not as scary as it sounds, so it is a procedure that you're sedated for under anesthesia. On our free colonoscopy day, we have anesthesiologists volunteering their time to put people to sleep to do the procedure. So you do have to do what's called a bowel prep. A bowel preparation means drinking laxative the night before the procedure to flush out the colon, get all the stool out of the colon so we can get a good look the next day. So that's kind of the horror stories that people hear is drinking laxative and getting flushed out, but that's just kind of part of the process. And honestly, it's not as bad as it sounds. You drink a couple bottles of laxative and get cleaned out, and then the next day it's a piece of cake. People wake up and ask when we're going to start. They don't even know that we did the procedure, and the procedure itself is only 15-20 minutes. It's very quick. We put a lighted scope camera, a long lighted camera into the bottom and look all the way around the colon, which is the large intestine, and look for those polyps. If we see a polyp, we take them out right then and there. There's different methods we have to remove polyps. If you don't have any polyps, then you're good to go. So colonoscopies are indicated for screening at age 50 or earlier if you have a family history, then you start at age 40. So if you're general population, no risk factors, no warning signs, meaning no change of bowel habits, no rectal bleeding, diarrhea, etc., and your parents or siblings did not have a colon cancer or polyp, then you should start your screening at age 50. Actually, I recommend that African Americans start at age 45 for those same average risk population. And then if you have a family history, if your parents or siblings have had polyps or cancer, then you should start at age 40. This particular free colonoscopy day is for, like I mentioned, the underserved or underinsured population. So those individuals that their work does not offer their insurance, or they're not able to, they're in between jobs and don't have insurance. Those are the people that we want to target right now, basically the people that flat out can't afford a colonoscopy. Colon cancer specifically is always very disappointing to find because it is so preventable. And so people are scared or apprehensive or embarrassed or nervous about getting a simple test that can save their life. And honestly, those are just not reasons that I'm willing to accept for people to put this off.